I know every case is different, but in general, do you think it is too risky slash increases your risk of breast cancer, etc., to start hormone therapy 4 to 5 years after menopause?
Um, no, I don't think it's too risky. It's better to start it before you go into menopause. You know, um, women's hormones are a lot more complex than men's because they have four hormones that change every month. So they drop off at different rates. The first one to drop off is usually progesterone. So you get estrogen dominant, and when you have too much estrogen in relation to progesterone, you tend to get fibrocystic breast, uterine fibroids, crazy periods, and sometimes too heavy of periods, clotting, that type of thing. Then anemia and all the other things that go along with it. But so, and it's known that by the time you are in full blown menopause, which is 1 year after no period, you've already lost a lot of your bone volume. One of the reasons you're doing this is to preserve your bones. Um, so it's better to start early, but it's not too late for sure. Um, it's not going to increase your risk of breast cancer um, by starting on a little bit late. We use bioidentical hormones. We don't use synthetic hormones. You don't want to start any form of estrogen on a woman that already has breast cancer. That's why you need your mammogram, or if you do thermography, that you need to get that clear before you start, and then you need to undergo your regular monitoring. Um, and keep an eye on. You don't want to get too much estrogen. And you want remember progesterone protects your breast against too much estrogen. Same thing with your uterus, with uterine prevention of uterine cancer. Um, you can't give unopposed estrogen to a woman who has a uterus. You need progesterone to protect. So in a lot of ways, progesterone's, the maybe the primary female hormone. But you need all, and women need testosterone as well, and DHEA. So every case is different, but no, I don't think it's too late to start HRT 4 to 5 years after menopause. It's very important. If women take bioidentical hormones in midlife, they're about half as likely to get demented as if they don't. So you're looking at brain protection as well, heart protection, that type of thing. So,
So it
um,
seemed that they knew you might say no. And the follow up is, if your answer is no, why do you think so many traditional MDs are still saying this? And I think this is a common question. That's the reason I wanted to add this in
yeah.
there.
Well, they're just way behind. They don't do the research, and they're telling you what they learned in medical school 30 years ago, 40 years ago. In my case, that's what I was taught. But if you do a deep dive into it, again, I did a fellowship in this years ago, and I didn't have any clue about hormones. Most doctors just don't know about hormones. It's not their fault. They're just not taught that, and they're going to take the standard answer that they've been going on for years and ignoring all the benefits of it. So, we're not looking for normal. I mean, I'm not scared to practice medicine. I'm not, a lot of people, especially your gynecologists, for some reason, those are the people that should know hormones the best. But I've found many gynecologists don't know the difference between a bioidentical progesterone and synthetic progesterone, which is medroxyprogesterone. They're entirely different chemicals, molecular structures, if you look at it. But um, and their standard answer is, well, you're going into menopause. Let's either put you on the birth control pill, which is synthetic hormones that are dangerous at that age, or Prozac because you're getting depressed because of it. So that's a lot of times the standard. Plus, there's no money in hormone replacements. I mean, it's easier to just say no. You're getting old. But the thing is, we're living a long time. When your hormones decline, you decline in every way. It's like nature saying to you, you're finished reproducing, start dying. The problem is we're living a long time. So if you don't live that second half or third of your life without hormones, you're going to get brittle in the brain and the bones and your energy, your skin, your hair, your vitality, your libido. You lose muscle, you gain fat. There's every reason in the world. So most traditional MDs just don't know. They're not familiar with hormones. That's as simple as answer as I can get it. So, do your own research. Read Dr. Pam Smith's book about all about women's hormones. She's one of the leading gurus of women's hormone replacement. She's a well-respected internist in Detroit, and she had a great book on it if you want to read it. But um, so, it's up to everybody what they want to do. It's just kind of a shame that um, a lot of doctors just don't know the recent research on hormone replacement therapy. A lot of doctors still think testosterone causes prostate cancer or heart disease. It doesn't, it prevents them, and they don't know that you should check estrogen levels in men as well, as well as testosterone levels in women. So it's just lack of knowledge. It's not your doctor's fault. Just they have, if they start taking a deep dive and seeing thousands of patients that, tell them it's changed their life and you can see it. So, we're not meant to just wither away. So that's my short answer.
Well, that was well said. That was well said. And if anybody knows anybody that is afraid of hormones or is hearing that, hormones are dangerous, send them to that clip, guys.
You should be afraid. You should be afraid not to take hormones.
That's right.
More afraid not to take them, but get your checkups. And, there's a few women I wouldn't put on any form of estrogen. And again, it's complex. You gotta think which pathways is going down, which ways is the estrone being metabolized. There's 3 different pathways. There's 3 different forms of estrogen. So it's kind of complex, and they don't teach this in school. They just don't teach it.